welcome to this latest episode in the All in Skills podcast. All in Skills, for anyone who's not yet familiar with it, is an online platform designed for coaching and mentoring, whereby young people, undergraduates, new graduates, people who are new on the job market can find mentors and coaches to help advise them and make decisions about issues that they are confronting. Today, I'm very happy to be joined by Phil Benjamin. Phil, thank you for joining me.
Nice to meet you, Colin.
Phil, if you can start off just by telling me who you are, what you do, and in fact where you are, because I don't think you're near me today, are you?
No, I'm in what I like to call the Noosa hinterland. I moved up from Melbourne in 2010 um, to expand my horizons, you might say. But I started working as a mental health nurse in 1975, which at that time was all based in the big mental hospitals around Melbourne. So I started working in a place called Mont Park, which had something like 1,000 beds, and then after a year moved up the hill, as we like to call it, to a hospital called the Rundle, where I spent the next 2 years and learned about mental illness and various therapeutic modalities. Psychiatry in those days was much different to what we have now. The idea wasn't based on so much diagnosis as on actually responding to the individual. It was before psychoanalysis had been discarded, so we were interested in what people were thinking rather than what simply we could observe in their behavior and what they said. So that was very interesting, but I wasn't all that happy working in a large institution, so left soon after and ended up getting a job in Broken Hill, which was 700 kilometres from Melbourne and 800 kilometres to Sydney, in a very small mining town where the emphasis was on football and beer, but there was a small arts community there. So I have found a niche there, but because I'd been interested in what we call developmental psychiatry, I got involved with local Lifeline organisation and started working with families and kids. And at the end of a couple of years there, decided I was more interested in trying to prevent mental illness, and thought the best way to do that would be to work as a teacher. I didn't really enjoy the environment in the high schools, so I went back to nursing, and I've been since 1975 working as a mental health nurse, and gravitated towards the crisis teams, which are called in various different states, different names. In Queensland, they're called the acute care team. But really, since then, I've gravitated towards working in the emergency departments, which is where I find the most rewarding opportunity to engage with people. Meet some very interesting people working in an emergency department. And in the meantime, I've changed my approach and consider myself to be what we now call trauma informed, which is understanding that most people's distressing experiences are related to previous harm that they've experienced.
When you finished school, what choices were you faced with when it came to what am I going to do next?
Well, I grew up at a time when the world was in turmoil, really, in the 60s and 70s and early 70s. And in fact, my choice was to go to Israel for the year with a group of friends to have a year of experience there. And because I really wasn't a very committed student, I managed to scrape through my high school years just on, I guess, native cunning, and did reasonably well in sciences. So it was obvious that I should go and study sciences, which was not a success. So I eventually ended up leaving university and working various jobs, and then just by coincidence, at the age of 20, bumped into someone who was just about to start a nursing degree. And so, well, in those days, it wasn't a degree, it was a certificate, hospital-based training. And so that seemed to appeal to me, not so much the general nursing, but the idea of working with mental health, because I'd always been quite interested in the workings of the mind and literally started 3 days later.
At quite a young age, you had in mind that mental health was something that you wanted to focus on.
I hadn't really thought about it per se as a career, but as soon as someone mentioned that as an option, it just seemed like the right fit for me.
What was the male to female ratio of people that you were studying with back then?
It was pretty even actually, and in mental health, working in a big mental hospital, I don't know whether it was the selecting process, but it was fairly even. And by amazing coincidence, I'm now working in the same hospital as one of my colleagues then from 1975. We both celebrated 50 years working. Well, she said, well, no, it's 52 years for me because I started a couple of years before you, but we started training in the same week. So that's interesting. Both of us a long way from where we started. The ratio, I think, was fairly even, and it may have been through the selection process. But what's really interesting in terms of my training compared to what the nurses do now is when I look back at my transcript, I had 300 classroom hours, which really is a significantly larger amount of training and education than nurses now get, who might have, you know, 4 hours in the classroom for 10 weeks, 3 times a year for 3 years. So add to that 300 hours of classroom time the fact that we were working in the wards and we were being paid. So that was another attraction for me. We were working in the wards eight months of the year, 9 months of the year. So we had huge amount of direct experience and mentoring, although I have to admit a lot of that mentoring was not what I would consider to be a good practice. There was a lot of corruption in those large institutions, which I think is a good reason that they were closed down. However, the way they were closed down was not satisfactory.
I do remember that the UK had large mental institutions that were progressively closed down, especially throughout the 1980s. Was it a similar situation in this country?
No, it's quite different. In the UK, you still have large institutions which exist. I've visited a few of them in my time. But no, what happened here was they just closed them down. People were kicked out with very little in the way of planning. We had a politician here in Victoria, a premier called Jeff Kennett, who very quickly sold off the prime real estate and didn't actually provide the funding that had been promised for the people who were effectively kicked out and ended up in very substandard accommodation, a lot of them. That's been rectified over the last 50 years, 40 years, but still was very tragic at the time.
What then happened to the people in your position, the people providing care for people with mental health issues?
Well, a lot of them left. I remember I was in the UK in 79 to 91, to 81 rather. And I'd been working with some very sophisticated clinicians, nurses, psychologists, social workers before I left in a child and adolescent service. And when I got back in that 91, I tried to track them down, and most of them had just left. Been so appalled by what had happened that the whole service, the most well-equipped, sophisticated clinicians basically left, and that left the whole service in a state that I call de-skilled. And at exactly that time, they stopped training people to be mental health nurses. They were all trained as general nurses and then expected to be mentored by their colleagues when they started work as graduates. And as I said, in my experience, all of existing staff who had the skills had left.
Were these, were these decisions made federally or at a state level?
Now, in each state, they made the same decisions.
There was sort of a harmony across state lines to come to similar conclusions.
Yeah, yeah. And it's interesting. I'm not sure if you've noticed or been aware that there's a big outcry at the moment in Queensland about one of these big institutions where a lot of people were very badly abused. And there's now a move to have a royal commission into what had happened there to get some restitution for people who were really quite severely injured and certainly not helped in that large institution. There was corruption and physical and sexual abuse was out of control, really. But there were other ways to close down the system. What they did in Italy was much more effective. Rather than closing down the big hospitals en masse, they just said no one else will be allowed to be admitted to one of these hospitals. That's why they set up effective community, properly funded and serviced community teams. I mean, we have community teams here. I mean, for example, I'm familiar with one community acute care team, which has 70 patients on their list and 5 people working on each shift. So they don't actually get what they term care. It's more of a supervision arrangement rather than any direct intervention.
You mentioned previously that they then changed the nursing qualification so that people didn't train to be mental health care nurses per se, but they did something more general and then entered the area. Is that something that continues, or is that something that then changed again?
Yeah, it is. It's quite interesting working because I'm not sure if you know, but in the UK, people can still do a 4-year mental health nursing degree. And so working with UK trained nurses in this country, and there are a lot of them, is a very different experience than working with Australian nurses who are trained as general nurses for 3 years. And I've had an opportunity to do some teaching in one of those or two of those courses. And really, they get the sort of introductory training to mental health nursing, which is not much more sophisticated than reading something on YouTube or Google, asking, some questions on Google. They don't have any direct experience of working with people with mental health problems. And so they really, there seems to be two groups of nurses, uh, barely tolerate the idea that someone might have a mental illness, and the others who are very interested in working with those people. But that doesn't mean that they've actually been provided with the skills they need to work effectively or are in an environment where even if they have those skills, um, they can utilize those skills because of the structure of the way inpatient care works. I mean, the irony is that the most unwell people are admitted to the hospitals and the most junior staff are working in those inpatient units. People see their career path as getting out of those units so that they work in the community or in academia or in management as soon as they can.
Is it the case then that people are not getting the necessary mental health care in the system as it exists at the moment?
Well, I think that's well known. It depends what you mean by appropriate mental health care. If your view of mental health care is a prescription, then people generally are getting treatment. But if your view of mental health is that people need an opportunity to process what's happened in their lives and find a new way of living, as is prominent in the wellness community, then they're probably not. And to be honest, I mean, there's always been a shortage of staff in mental health. I'm well over retirement age, but I still work 2 or 3 days a week because I feel like I've got something to contribute. And to be honest, I meet some very interesting people in my work. People who are brought in. Well, I work in an emergency department, and people who come in seeking help or are brought in by family or police or the ambulance are very interesting people to sit and talk to. So I get a lot of enjoyment out of the fact that I feel like after this length of time in the career, I've actually developed the skills I need to help people to a certain degree. I actually find it quite interesting to meet and talk to them.
Who's on the team? How many people are there sort of working and collaborating with you?
Well, I work in a team which is extremely well structured generally. This is in central Brisbane, and there are usually 3 people, 3 clinicians, as we're called. So that'll be a nurse, a doctor, a social worker, or an OT, someone in those 3 allied health professions, 3 of us clinicians, plus 2 trainee psychiatrists, plus a psychiatrist on call. And then in the middle of the day, there'll be 2 more people come on. And then at the end of the day, when the 3 from the morning shift finish, another 2 will come on. As I say, that's why I like working in this setting. But on the other hand, a couple of nights ago, I was there by myself for a couple of hours. So that was sort of, I guess, a rostering issue, people coming and going. And, it wasn't a problem. I wasn't able to see any of the patients in that time. I really was just monitoring the phone and taking referrals and other calls. It was only for 2 hours, but so it sort of varies.
But that would be an exception rather than the rule.
I remember that happened once, probably a couple of years ago, but there happened to be 2 people off sick on that day.
You've been involved in this profession, as you said, for 5 decades. What do you notice about the people coming through now, qualifying as nurses and entering the profession, that perhaps has changed over the years in terms of motivation, in terms of perhaps their perception of their role and the profession?
Uh, that's a hard one. I think I can't really put my finger on anything specific. I think that it's probably more just a difference in the generations. When we were in our early 20s, the world was a completely different place. I think perhaps people have got a different view of mental illness. I think in those days, where people really didn't know what mental illness was. Now everyone has heard of schizophrenia and bipolar and narcissism and all those sort of technical terms, which are now used as common vernacular without any real reference to their original meaning in many cases. So people have got a bit of an idea about what they're coming into, but I can't really think of anything more than that in terms of what's different.
I wonder if there's been a societal change in attitude towards mental illness. Perhaps in the past, to my mind, I'm thinking it was something out of sight and out of mind. And today, as you say, partly because there's a raised awareness of mental health and the importance of mental health and talking about problems and not just burying them. I wonder if that has changed things at all, or if that's perhaps my misconception of how things have changed over time.
Yeah, I think that's true. And I think the other thing that's happened is that the idea of being neurodivergent has become much more acceptable. People now identify with satisfaction if they're neurodivergent, whereas previously these were the weird kids, the kids who were bullied in the back in the playground, and so they were much more vulnerable to being injured morally and emotionally as well as physically by the reactions of their so-called normal peers. I think the thing that has not changed that's quite interesting is that while we've become much more acutely aware of the effects of trauma, childhood trauma, particularly victims of pedophilia and victims of DV, there's been the obvious corollary to that is that people who have grown up with those experiences are going to have problems with their mental health. So that when someone comes into service, rather than being asked, what has happened to you? They're asked, what's wrong with you? And so that link is just sort of missing. It's something that it's a sort of conceptual link that hasn't been made by the mainstream media and by politicians, as far as I can tell. The people who come in, and invariably when you start digging, people have had huge amount of loss and trauma. I mean, two really important predictive factors for someone becoming psychotic, being a first generation refugee and losing a parent, particularly a mother in childhood. That's well known. But yet when I had recently a 24-year-old man who had Kenyan parents and whose mother died when he was 8 and was talking about voices in his head, the system didn't accept that this guy might have some sort of psychotic experience. He was kicked out. And so these dots haven't been joined up in the mainstream as far as I can see.
You said something interesting in your introduction. You seem to have moved around quite a lot. Is that true? Is that the case?
I went to Broken Hill for 2.5 years. I was back in Melbourne for, I guess, 10 years, and in the UK for 2 years, and back in Melbourne for 6 years, and then moved to New South Wales for a couple of years and back to Melbourne. And so I've moved not frequently, but a few times, not, for a few years at a time in each case. I have also done some contracts. I took a 3-month contract in Broome, which was very interesting. People may not know Broome, but it's in the far northwest corner of Australia, diagonally opposite Melbourne. It's quite a small Indigenous community, or basically Indigenous and fishing community, and that was very interesting. I've worked in some regional towns just because I can, I suppose. Uh, and to be honest, it pays a bit better when you go to one of those regional places. It's always helpful.
I imagine what you actually have is a qualification that enables you to do that, to make those choices and to say, actually, I can and I will try that.
Yes. Well, that's true. One of the most, I mean, I think medicine and nursing are two of the most easily transportable uh, qualifications. When I was actually thinking of working in the UK for a while, but then I had to actually prove I could speak English. I had to prove an IELTS, and then there were a few more hoops, and I decided that really to go and work in the UK, I'd be on half the salary I was here. So I did never do it, but it was a possibility, and there are a lot of UK and Irish trained nurses working in the system here for that reason.
If a young person today who's listening to this or was to come up to you and say, look, I'm considering a career in mental health nursing, psychiatric nursing, what would your word or words of advice be to that young person?
I would say that it's a really interesting career, that it is an opportunity to understand a lot about what happens between people and within people, but you've really got to be prepared to think about who you are. It can be very challenging, but also very rewarding. I think it's really important not to take things too personally. You know, it's easy if someone is not happy about where they are for them to lash out verbally towards you, but it's important not to take that personally.